Good afternoon, everyone, and thanks for taking time out. I am Charles Kwaku-Odoi, Chief Officer of the Caribbean and African Health Network, and I'm going to do, kind of 15 minutes or so presentation about, striving for health equity, and then, take questions. Well, and then Erinma will present, and then after that, it will be, time for, questions. Great. So I'm Chief Officer for an organization, CAHN. The vision really is eradicating health inequalities for Caribbean and African people within a generation. And we know that's ambitious, but it's always good to have a dream and to keep dreaming and working towards the dream. So our mission really as an organization, there are many grassroots Black-led organizations around Greater Manchester, but we focus on leading strategic engagement on behalf of our community. And then on the other hand, where we see gaps in service provision, then we, plug that. And the strapline we use for our work is reducing health inequalities, influencing policy and practice. I think that policy bit is really important. So as an organization, we seek to lead, educate, support, advocate, and enhance what is happening within our community. So those are the bits, I mentioned about earlier on. Our core objectives really is working with the Caribbean and African community, and we know faith is a big part of the community. So we seek to, we value the role of faith and we engage with faith-based organizations accordingly. And for us as an organization, it's all about partnership building, engaging continuously with our community in consultations, planning, making sure we always in touch with everyone. Well, I'm in touch with the community and, abreast with real issues, and also find ways to champion the work of Caribbean African-led organizations. So yes, when we talk of health inequalities, I know, many of you will be aware, but some of the things that comes to mind are, how do we as a system, how do we as organizations, how do we make sure, where there are, we can avoid, unfair systematic differences between groups. And, the phrase being used is the pandemic is exposed or as exacerbated, the health stacking in health inequalities we aware of. But some of these unfair systems or differences or structural barriers, it results in higher rates of mortality and morbidity, unequal access to care, treatment, services, but also, wider in, determinants of health, and that can be reflected across a number of indicators impacting on socioeconomic and environmental factors that people from those minority communities live with. So with regards to health inequalities, we're talking about how we make comparison between, smaller, population sizes and then, majority population. And a key word from, Sir Michael Marmot's work is about proportional universalism. And that's about how we ensure that people have equal access, or we can enable and facilitate people reaching their full potential. So we're very conscious as an organization. So although we health focus, we realize that, health is influenced by many other factors or the wider social determinants of health. And, and we know that there are some interconnections. So whether it's, genetics, behaviors, environmental, physical influence, or having access or other social economic factors all tend to impact or all tends to contribute to health inequalities. Right, so now coming to some of the disparities we are aware of, and it's right from education, whether access to housing, environmental conditions, and where people live, and but also differences in health experience and outcomes. So we know some of these are geographical. So if you live in North Manchester, or if you live in Oldham compared to someone living in Stockport, then there are different life chances there, differences in terms of outcomes. So for those minority communities or the Caribbean African, it's similarly reflected in there. And there are differences when it comes to how people are treated, even within our criminal justice system, and that impacts on people's mental health. and also differences in how people, get jobs paid for what they're qualified for, not always having to prove themselves on a daily basis. So yeah, a couple of documents that you could refer to later: Framework for Action 2010, Health Inequalities, and some of the Michael Marmot work. And I think particularly for CAHN, we're really delighted that race has been added, as a determinant of health. And so therefore we believe strongly with Manchester, Greater Manchester having signed up and wanting to be the first city region, first Marmot city region, then that provides us with some real opportunities. But as many of you may be aware, although we have devolution, our health service across the UK is undergoing changes, and who knows how that might impact on, what we end up with. So we were formed as a result of health inequalities, and it's something we've been trying to shine a light on, pre-COVID. So whether it's about lack of trust for, the healthcare system, or limited access to tailored services, so making sure that services are culturally and religiously appropriate, whether it's about lack of investment to tackle delayed presentation, and we know people present late, or addressing the 1% or so of Black people who are in senior decision-making, tables or spheres, because we know lived experience is really important, and there's so much evidence base out there. And how do we get people to influence policy and practice? And, do people really know some of the issues, but also all the, systems that have been set up, which, unintentionally, have become exclusive and excludes people? How do we tackle that? So always to bring it home, when we do our presentations, do a quick, health inequalities quiz. So, I'm sure some of you may be aware, but, so for example, what's the likelihood of a Black person having stroke compared to a white person? So you can guess that. How many times is it, more likely for a Black woman to die from complications related to pregnancy and, during childbirth? And also the likelihood of a Black baby dying within the first 28 days, or likelihood of prostate cancer for a Black man living in the UK. And these things, as you answer them and you get the responses to it paints the picture of health inequality. So a Black person twice more likely to have stroke, a Black woman during childbirth, it used to be 5, with the last Embrace report, it's gone down to 4. And then, our Black babies, 122% more likely to die within the first 28 days of delivery. And there have been various research, and some of these issues we're talking about is not just peculiar to the UK, but also in the US. So there have been various studies to show that if, a Black woman is having a baby and the doctors are, obstetricians are Black, then, the baby has higher chances of survival. But that shouldn't be the case. And these are the inequalities. And with prostate, 1 in 4 Black men would have prostate cancer, yet there isn't any targeted intervention, at national level. So I suppose for CAHN, the barriers or the structures we engaging with in order to bring about change and sustainable change, it's about decision-making and representation, and making sure that is not tokenistic. It's about how sometimes we challenge benchmarking to majority population. So, we've seen some of this, whether via the PPE, fit testing, or, some of the conversations we're having about vitamin D campaign we're running, and the national recommended dosage level. All these things are currently, yes, there's a talk of low uptake of the COVID-19 vaccine among, BME population group. Yes, still, the recommended priority list and the age 50 and above, 75% of our population group will be excluded from that. How do we tackle, racial discrimination, whether it is conscious or unconscious bias? And then, challenging and advocating for investment into community engagement, but also engaging with faith groups, because faith tends to be a key part of people from ethnic minority backgrounds. So we've adopted a social movement approach where, yes, we work with decision makers to address some of these causes, but then find a way to make sure that the power and the voice rest with our community. And so we keep advocating for co-designed, the things we do. So for example, we've been running since, and if I come to the response to COVID, we've been running what we call health hours since the 2nd, of May last year. So the first Saturday of May, every Saturday it's been running. The only break we took was over Christmas and New Year, 2 weeks off. But every Saturday morning, we have health professionals who come and engage with our community on particular topics and then reaffirm the public health messaging. So what we keep looking for is system-wide collaboration, system-wide change, so that it's sustainable. So whether working with acute, foundation trust, and I'm a governor of Manchester Foundation Trust, or engagement with local authorities and facilitating a sounding board for the for Manchester City Council and Manchester Health and Care Commissioning, or work with a Penine around mental health, supporting their BAME staff network. We're looking for system-wide collaboration so that the impact is long lasting. So we all are aware of the disproportionate impact of COVID. Yes, we've been involved in some analysis looking at the difference between waves 1, wave 2. So I go along to the government, SAGE ethnicity subgroup, and we're weighing some of that. And we know what we've been saying is, yes, ONS data is out. It seems to suggest that where the impact is more at the moment is the Pakistani and Bangladeshi. But what we're saying is we're not out of the woods yet, because some of these things have been prehistoric, and we need to be careful how we quickly, move on from that. We did our own primary survey, still talking about health inequalities, and we ensured that some of the outcomes did inform our, what we do as an organization. So for example, since last June thereabout, and we set up a Black-led counseling service to respond to low-level mental health, because the African Caribbean Mental Health Services deals with severe and enduring mental health. So we're dealing with the low-level stuff, but also we've been responding to, people who have been bereaved and providing bereavement support. And that is translated into a peer support group that we run. But you can see, from some of that data where some of the needs were. And some of these things reflect the national picture. And then what has been key during our response is making sure that we're not creating further exclusion for people who do not have English as their first language. So most of the services we do, we make sure that we try as much as possible to promote in French, because there's a big Francophone, African community right across Greater Manchester. We've done stuff with Portuguese, speaking Africans, and sometimes, Northern Africans, and some targeted engagement with the Somali, community as well. But the bereavement has been going on, and we've been running a few other events. We've been running a series of vaccine, sessions and vaccine webinars, because we knew even before, a vaccine was approved, that there will be issues in our community, because lack of trust is the biggest thing. And, that hasn't been helped by the, changes and sometimes, moves in stance when it comes to comms and the way people are engaged. So some of the concerns that came from the community were, some are still wondering whether COVID is still here, but also how, the vaccine interact with other medication. Some have been making the case, why don't we invest more into prevention, rather than trying to force people to have vaccines, and stuff around the ingredients, but also the side effects, which we're still learning about, and we still know. But, a big thing has been around fertility, and people wondering, where, why the messaging has changed. So previously we're told pregnant women weren't involved in the trial. Since then, we've now known that there were people pregnant involved in the trial who, didn't know, and they've had their babies, and mothers' babies are safe. But also all the stuff around people with underlying health conditions, and the faith angle. So these are things, we've been dealing with. So in kind of trying to wrap up, why do we do what we do? And, you know, I think we do what we do because it has to be all about change and how we bring about systemic change. We know not many people from our community with the lived experience sit around decision-making tables. We know, you know, sadly, in some quarters, there is stereotyping and being treated unfairly. And we know that we need to galvanize our community for, you know, self-action, self-do, self-can. You know, there are wider determinants that do, you know, impact on people from minority background. And the health situation is dire, is poor. So whether you look at obesity and the rates at the moment, you know, diabetes, some of the cancers, there is disproportionate impact. We know that we need, you know, evidence-based, you know, argument and conversations, and we need to, you know, do lots of collecting intelligence to inform the change. That is why, you know, we did our own primary, you know, research or survey during the first wave of the pandemic. We had a vaccines event on the 16th of January, perhaps the biggest, you know, live one or one of the biggest in the country, 1,000 people on Zoom at any one time, you know, 480 odd on YouTube live, and then another 270 plus or so on Facebook live, all people from our community. And what we keep saying is when people have engaged, when they've had their questions answered, then they make the lifestyle changes that they have to. And what we've seen with the vaccine is people, you know, making up their mind because they're well informed. They've seen people, you know, so on the 16th of January, we had about 17 plus Black GPs and senior consultants across the NHS, some in London predominantly, you know, some from Manchester, engaging with the community, sharing about why they took the vaccines. And of 220 people who gave feedback following that engagement, they made their mind, you know, to receive the vaccine. We know it has to be about changing, you know, policy and practice, because, you know, if policy is changed, but yes, still that is not implemented, then we won't get the change that we need. So I'm going to pause over there and then give Erinma an opportunity to do her presentation, and then we can take, you know, some questions.
Thank you, Charles.
Thank you, everybody, and good afternoon. Sorry I was a bit late. It's having a bit of a technical panic attack, as we do. Oh, listen, you don't know. You know the swan scenario? That was me, you know. And I'm like, oh, it's not working. So I've got two things on, as you will see, just in case if one decides I'm not working today. So I'm going to share my screen without much more further ado, so I don't take up too much time. My name is Erinma Bell, and hopefully my screen will share. You see, I've done screen share. If not, let me do it on my laptop. Sorry. I'm going to, because it's not having it on there. Or does somebody have to take theirs off for me to do mine?
Oh, you should be okay, Erinma.
Oh, do you know what it is? I know what it is. You need to do it on the second thing that I signed into. So just give me a screenshot on both my names.
Oh,
Yeah.
She's so good, they named her twice. Hold on a minute.
Thank you.
Yeah. Right, okay. Try now.
Yeah, doing it now. There we go. Okay, so hopefully you can see my screen. We have liftoff. Slideshow. So can you hear me? Right,
Yes, we
good,
can hear
thank you. It's going to take a while for it to expand and go big, but as I said, Erinma Bell, I am a community peace activist. I do have an MBE. I'm a Deputy Lieutenant for the County of Greater Manchester, and I'm going to try and take you through my slides if it decides to change. Otherwise, I'll just make my screen a little bit bigger. Oh, okay. There we go. That should do it. There we go. A lot of you may or may not know that run my own organisation known as CARISMA. We set up in the late 90s, early noughties. And even though we set up back then as a charity, we're now a limited company by guarantee, we did not have a clue what we were doing when it came to registering for organisations. We basically were a group of people responding to the gun crime issues that was quite prevalent in South Manchester. and more so in my neighborhood, Mosside. CARISMA is actually an acronym, Community Alliance for Renewal in a South Manchester area. And there's actually an activist story behind the reason why we chose such a long acronym, because we were trying to get things sorted and bring people together in our communities around gun crime to actually stop the gun crime. But when we spoke to people of authorities, we found that they were always throwing loads of acronyms at us and we didn't know what they were. So when we came up with a name, we thought, well, we're coming up with one as well. So that's where the name comes from. And now we just say CARISMA. However, like I said, most of you will know that in South Manchester, late 90s, in the noughties, gun crime was quite prevalent. This is the map of Manchester. This was then known as Division B, and this is where most of the firearm discharges and gun-related firearms or fatal shootings actually happened, which is primarily Mosside. So what this also is the result of an amnesty that, the police now actually do them quite regularly, or were up until COVID, once every 2 years. We were one of the first to ask for a guns amnesty to happen, in South Manchester, because one of the things we wanted to do was just rid the streets of the guns. And we said, if people are able to hand them in, because we knew of people that were coming to us, older people, as in, grandparents and parents saying, look, this is what I found under my grandson's bed. What do I do with it? Giving us weapons. And we're like, yeah, we used to go to the trusted police that we could work with and say, what do we do with it? And I must admit, in bringing people together, we found that we had to work with GMP. Many people didn't like the fact that we did. And when I say many people, our local people, as in our peers or within our local neighborhood. But we felt we had to, because they couldn't solve the issue on their own and we couldn't solve it on our own. We didn't trust the police. No, we didn't. And we did feel that, the police were not interested in sorting out the issue of gun crime because it was related to Black people, or it was more so labeled as Black on Black crime. The media labeled it as Black on Black crime. The newspapers, even, government officials. And one of the things that we knew, if you lived in the neighborhood, you knew it wasn't just the color of the hand that pulled the trigger was not always white. And also one of the things that we knew was it wasn't young people that were actually smuggling these weapons into the country. It was about focusing on the real issue, but I'll get to that. One of the things that I've found through all the work I've been doing over the 25 years is that conflict just is. It's something that happens. You can't really prevent it from happening. Usually I would ask, people, especially our age group, how did we know? And it only takes one person to answer. When we were back at school, how did we know there was a fight in the playground? How did you know? One person, just don't be shy, because I know you all used to do it.
I'm going to say everybody gathered around and shouted, fight, fight, fight.
Exactly. Absolutely. Thank you for that. And the thing is, that still happens today. Our young people still do that today. And the thing is, we're all responsible adults. We don't teach our young people, hey, you know what, when there's a fight in school, you've got to shout, fight, 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 and you've all got to gather around. It's something that happens. And it happens because as a human, we are somehow, and for some reason, we are fascinated with conflict. We're fascinated with it. Those of us who watch it, what's he called? The Nature Man, is it David Attenborough? When you watch all those nature programs, when the lion's going to get the gazelle or whatever, and we're going, get in, or someone going, no, no, no. We're fascinated with conflict. So one of the things that we have to learn to do is how do we manage conflict? Those of you who are teachers, maybe, it's something that you have to learn to do and have to learn to teach children to do, how to manage their conflict. If we're in the workplace, how do we manage the fallouts that we have with other work colleagues? If we're in a neighborhood, how do we manage the conflict and the fallout with other neighbors? Conflict will always happen. It's about learning how to manage the conflict rather than walking away from it. Because I'm sure some of us have tried it, especially in the workplace. You walk away from conflict thinking, oh, it's over. The next day, guess what? It's still there, because we haven't dealt with it. So what we did as a team of CARISMA, local people, and we're just a local people, local neighbors coming together who wanted to find out how can we bring an end to this gun crime? It was about bringing people together and working with different people, because it wasn't just one set of people's problem. It was labeled as a black on black crime, but you know, like I've already said, if you worked and lived in the neighborhood, it was also your problem. And this is what we were saying to local and central government. It's everybody's problem. I was told by, you know, the Home Secretary back then that actually, no, gun crime is a Mossad issue. And I was like, no, it's not. It's a UK issue. And she said, no, it's Mossad. Well, it's Manchester. And I remember the day I went to see her, I actually said to her, when I got on the train this morning and came down to London, as far as I was concerned, I'm sure Manchester was still in the UK. It's a UK issue. We had an issue with gun crime in the UK. And that is something that government didn't want to take notice of. It actually took us 6 years being that advocacy group, being that pressure group, not only on local government, but on central government. It took us 6 years for them to bring gun crime to the top of their agenda. And in those years, what we were doing was bringing people together around this common issue. And what we found that we didn't know we were doing it then, but we found that this is what we were doing. And this actually came out of, I mean, I've got a master's in urban education, and I was able to, you know, look at my theory and think, actually, this is what we're doing in practice, building social capital. And it's so important. And I've listed the 4 down there that I identified: bonding, because I haven't got them all listed on this because I know we don't have enough time. I usually go into it in more detail. But you've got bonding, bridging, linking, and identity. Bonding social capital. This is where people, they get together because they have something in common. Whether if it's dress code, language, food, work even, or maybe just because they want a sense of belonging. We all do that. We all gravitate towards people that look like us, sound like us, dress like us, or maybe work in the same place. We do that. As a woman, when I've gone down to ministerial meetings and I walk in the room and it's full of maybe, let's like 40 white middle-class men, but I see one woman, to me, it doesn't matter where she's from, I automatically, naturally go over to the one woman because she's got something in common as me. Bridge, and bonding is good for getting by. And one of the things we were showing people is, because we used to have people saying things like, oh, this is in our community, why do all the Somalians stick together? Why don't they come to our meetings? Well, they stick together because they're all from Somalia. They all speak the same language. They all dress the same. So why shouldn't they? But one thing we have to be careful with bonding social capital is that it can cause phobias. Those of us who are on the outside will look at them and think, and we get suspicious. Why are they all huddled over there? What are they talking about? I don't understand them. Are they terrorists? Are they, you know, all the phobias? I'm just trying to think. Islamophobia, xenophobia, homophobia. You know, the phobias are created by those of us who are not part of that group. So you have to be aware of that what role are you playing? Bridging. Bridging social capital is when we dare to step outside of our comfort zones and actually go into another community. That's what I found. It was about us back then, learning about other people in other communities, learning what they're about. How are they different from us? Why are they different? Linking social capital was about working with people in a hierarchical institution because they have the links that we need in order to fulfill our agenda and get our work done. They have the resources that we require to fill our agenda, to get our thing done. It was, you know, about linking with people in hierarchical institutions. And back then it was central government, it was the Home Office, and it was Greater Manchester Police. We had to link with them. The other form of social capital is identity. Identity is so important to individuals. And it's something that we, in our society, we tend to strip people of without even actually knowing that we're doing that. You know, by asking people things like, why do you have to wear that cultural attire? This is England. You know, why don't you have an accent like us? Why do you have a funny accent? That is part of their identity. Why don't you speak English properly? It's their identity, and it's okay. You know, I usually put up a picture of a salad bowl. And when you look at a salad bowl, you'll see all the individual pieces of salad. And the one thing we wouldn't do with a salad is put it in a blender and blend it up, because it's no longer a salad with individual, you know, identities. It becomes some sort of a slush. But in reality, that's what we try to do to people. You know, you have to, and this is why I hate the word integrate. You have to integrate with our society. No, people are here. And I mention that because I'm a deputy lieutenant. And one of the things I do as a deputy lieutenant is I perform the citizenship ceremonies, you know, when people become British citizens. And I remind them, you are an Iranian now coming here to live in Britain. You are maybe a Nigerian living out in Britain. You've taken on the British citizenship. What you do or what they do, and I always remind them, you're bringing your knowledge, your wisdom, your experiences to actually enrich our society. So it's not that they have to get rid of the fact that they're Nigerian. I mean, I'm a Nigerian. I'm a Nigerian born in Britain. My culture, my identity is so important to me. It is very, very important. It grounds me. I know who I am, where I'm from. And I bring all that cultural awareness and knowledge to make our society a fuller, more richer society. So we need to remember that as well, because again, it's something that we do, but we're not always conscious of the fact that we're doing it. One of the things we learn over the years is that we have to support and challenge each other, especially as communities. We were dealing with gun crime, and now there's knife crime. We were often attacking each other, not physically, but, you know, verbally, and blaming each other. And one of the things we had to do is like look inside of us first and find out, actually, what role are we playing in the whole gun crime issues? You know, I used to hear people used to come to our office and say, you know, the police don't care, you know, the councillors, most of them don't care because they just go back to their nice neighbourhoods, they don't care. And one of the things we actually posed to local people was, well, actually, why should they care? It's not their children. It's not their children being buried. It's our children. Our children are the ones that are being buried. What are we doing about it? How are we supporting each other instead of pointing fingers? We had to get local communities to actually own the issue, own the problem. It's our problem. Yes, it is. But it doesn't mean it's only for us to solve. But I show people when we can own the problem, own what part we play or not, because sometimes it was because adults were not talking to young people. I've had adults that have said to me in the past, oh, I can't talk to my son. I just can't get through to him. And I asked, oh, how old is he? He's 9. 9? You know, I'm like, 9? You can't speak to a 9-year-old? You know, it's like, and so we had to do a lot of parenting skills as well as what does being a parent mean? What does being an adult mean? I've even had that in schools because we do a lot of school assemblies and school workshops. Just very quickly, I went into a school and I was ready to do a workshop. It was up in Wythenshawe and they were all dead rowdy and teacher was trying to settle them down. And there was a young girl, she was about 13, 14, and she stood up, she's like, has anyone got a light? I need a light. Has anyone got a light? And the teacher went, look, can you just wait and just sit down because we want to talk about something? And I'm like, I'm looking at the teacher. You're telling her to just wait. You're supposed to pull them up on that. You're 13. You're not supposed to be smoking, you know, and it's that kind of, you know, challenging. When we say challenging first, working for the betterment of the wider community, because in doing all that, it's about everybody. It's not about me, and what I'm feeling and what I'm doing. It's about everybody. You know, bringing people together is about everybody. I can see someone smiling there. I like using pictures because it hits, you know, gets the message home. So it's not about me, I, me and my family. We live in communities. We work in communities. It's about all of us. And I used to say to people, are we going to wait, or are you going to wait to when gun crime is on your doorstep before you actually decide to do something about it? Well, really, we shouldn't. Prevention is better than cure. And it was also about focusing on the real issues. So really looking at what is the issue. So when we were talking about gun crime, like I said, you know, no young person gets up in the morning and decides, you know what, I'm going to get a gun today and I'm going to go out and kill someone, or I'm going to get a knife, I'm going to kill someone. We were saying to people, nobody does that. We have to look at the issues and situations that surround our young people and stop blaming them for everything. Look at the situations, look at the families they're from, look at the home settings that they're from, focusing on the real issue. This is what we were telling government. We were too quick to blame young people and lock them up without looking at the issues that surround them, and that's causing this. One of the things we said to the government, and it was key, and at the time something happened that was key. A young person was arrested on the streets of Mossad. He was 14 and he was arrested with a Kalashnikov weapon. The police did forensics on that Kalashnikov weapon, even though they were told not to. But like I said, we worked very closely like this with two very senior officers in GMP. And I mean, they were fantastic. They decided they're getting forensics done on this. And I think it's that thing of, you know, when you're told not to do something, you actually wonder why, and you go ahead and do it. That weapon had been used in the Bosnia War. So I put that to the Home Secretary. How does a weapon used in the Bosnia War get into our country, into our urban areas, and into the hands of a 14-year-old? Now, you can't tell me that 14-year-old smuggled that weapon in. He didn't even know where Piccadilly train station was, you know? So that's when, you know, when we back them up with certain information like that, which was factual information, they had to then realize that, yeah, we've got a problem. And that's when we were saying to them, this is what we talk about when we say focusing on the real issue. The real issue was, how were guns getting into our country? And probably still, you know, guns in this country, this is not America. Guns are illegal. So how do they get in here? How did that weapon travel from Bosnia to Manchester, Mossad? We found that in bringing people together, we were no longer, or I should say CARISMA was no longer like this, this top picture, because we were all never on the same page, all talking at cross purposes, not coming together, you know, all blaming each other. Because then what happens is the power that be, they're able to just swallow us up, push us aside, ignore us, you know. Whereas when we managed to motivate people, to mobilize them, network, and bring people together, we then became like this lower picture where we had the power. And we realized back then that, guess what? There's power in people if we're all on the same page. Some of us, we up here, we had the same book. We all knew it was about gun crime, but we weren't on the same page. When we came together as one people, one voice saying the same thing, we were then able to turn things around and get the powers that be to listen to us. It was about networking, mobilizing, and advocating. That's what this bottom part of this picture was about. It was about networking, networking with the different organizations, different people that we needed to. I was once asked, why did I have a meeting with Michael Howard when he was leader of the opposition party? And I was asked by our own Labour, and I said, look, we just want to talk to whoever can get the job done. You know, we're not into the politics. If you can get the job done, we're talking to you. Mobilizing. The mobilizing was about mobilizing local people together, coming together to have that one voice, and advocating, speaking up on behalf of the voiceless, which was often our young people. They got the blame for everything. Young people got the blame, single parents got the blame, you know, that it's because these young boys who get involved in gun crime, it's because they come from single families. Codswallop, because there are single families who bring up their children absolutely fantastically. So you can't blame the fact that it's from they're from single parent homes. It was about advocating on behalf of the voiceless, those that don't have a voice. And then also about thinking about conflict positively. A lot of the work that we have done in CARISMA, we do have a toolkit. A lot of the work we've done, we've tried to turn negatives into positives. And that's what we were doing with gun crime, changing it into something positive, changing the ways and the mindsets of our young people positively, and changing the mindsets of the way adults thought about our young people, changing that into something positive as well. Again, I have lots of other presentations that I do individually about these things, but I know, you know, we're on a time thing today. But this is what I like to tell people: never give up. We do have the power to shape the future. We absolutely do. If we come together, mobilize, and all speak with the one voice, we do have the power to change things. Mossad in itself has changed. Mossad, Alexandra Park Estate, was an estate that in the late 90s, early 90s, nobody wanted to live on that estate. Now they've got over a 2-year waiting list. There were houses on Great Western Street that were going for, you know, 8, 10, 12,000, and I wish I'd bought a couple back then. But now those houses are going for like 180 odd thousand, just over 200,000 pounds. Loads of students live in the area. I feel like I live in the middle of Bedsit land. However, it's a great place to be, a safe place to be, because we shaped our future and changed things around. So I think I'm stopping there. Yeah, thank you for listening.
Thank you, Erinma, so much. Shall we open the floor now to any questions? Anyone got anything they would like to ask Erinma or Charles?
Yeah, I'm here.
Yeah.
Have we just blown you away?
Yeah, that was amazing. Erinma, that was really, really inspirational. And I've heard Charles speak before, and that was great from Charles as well. I guess my question is, if you were given the chance to, I don't know, be in charge of health inequalities for the whole of the UK or the whole of England, let's say, in Westminster, and what might be the first thing you'd change on day one, or the first 100 days or whatever of taking charge, what you might change to bring about those changes that you wanted to see, and then also maybe the other end of the scale, what do you think people can do to support bringing about health equality, everyday people, no matter what community they're from. So something about the top, what would you change on your first day in charge if you could, and kind of something about people and what people can do no matter what community they're from.
I take it that's for Charles. Charles?
Oh, no, both of you, if you don't mind.
Oh, okay. I think for me, one of the things I would do, at the top, is actually about trying to really understand, when we use the term health inequalities, what do we actually mean? What does that mean? Let's analyze it, pull it apart. What does that mean? And actually, I think what's really key is actually meeting real people and getting to hear their stories, their pros and cons about anything, because what people tend to do from the top, and this is what we found, and hence why we said to local, central government, this is why, a lot of work we did was around stop and search. But what they tend to do is they come out with their policies and their law, and then they just impose it on people. And then they wonder, why is it not working? Because you haven't consulted with us to actually find out what the real issue is. Yes, we know there's health inequalities, but why is there health inequalities? Let's dig a bit further. Why? And at the lower end, I think what individuals can do, I think it's about us also understanding and daring to ask those difficult questions, of people that are different from us, that are supposedly have, those health inequality issues. I think it's about asking those difficult questions, because one of the things we don't do in our societies, we don't ask difficult questions because we don't want to offend. So we tend not to ask. But when we don't ask, guess what? We don't know. And when we don't know, we don't understand. And so there we just go, we then just follow the masses, whatever the masses is saying, or whatever's in the local rag, we then believe that and take that on board to be the case. Whereas we've got someone probably next to us, maybe in our neighborhood or in our office, that we can actually go and ask, well, actually, you know what? I heard such and such in the media. Is it true? I just want to know. But, most of the time we don't do that because we don't, I don't know if it's one of our things that we do as British people, we don't want to offend, so we don't ask. And we walk away and we just don't know, but we don't say we don't know. Sorry, that's me.
Yeah, that's brilliant. Thank you.
And also, if I can just say that then is about, the cultural intelligence, being culturally intelligently aware, social intelligence, emotional intelligence. We're all human beings. And we should have that. And the thing is, if we don't have cultural intelligence, ask the question about somebody's culture if we don't understand it. And tell them that I'm just asking to understand. That's social intelligence. I'm asking to understand. Very quickly before Charles comes in, I remember I did something with my Nigerian women's group. We actually did something with, I've got two examples, with the LGBT community. And they were all like, we're going to talk to them? We're going to sit with them? And I was like, honestly, to tell you, I was actually really shocked. I was like, well, what do you mean them? What, we don't have, LGBT people in Africa, in Nigeria? No. I said, well, actually, we do. And I went way out of my way to find LGBT people that were not only Black people, they were Africans and they were from Nigeria. And it was kind of like, bam, right. But yeah, it's all about that social awareness, intelligence, cultural intelligence, and emotional. Sorry, I'll get off my soapbox now.
Well, I think Erinma said it. The little bit I'm going to chip in. we realize the complexities and the big things that needs to happen and sometimes how difficult. I think the starting point is there. I know how to reach, groups or how to reach communities. It's usually the model of engagement that hasn't worked. And we can systematically engage with groups. We can systematically engage with communities and different ethnicities. And like, Erinma talked about, intersectionality is a big thing. So there have been times, there's been brilliant work done in the LGBTQ community. How do we take the learning and translate it into other communities? How do we learn from what is working very well in one community? We all know language happens to be a big thing, and it's not just about having interpreters, because as Erinma mentioned, it's that cultural intelligence. We've had people who have had, who've had cases where the interpreter is not from that country, interprets things verbatim, and the outcomes are poor. So, a classic example I always make reference to, there was a man in social services were involved wanting to take his child away. And during one of those meetings, he said, "Oh, what do you want me to do? Do you want me to kill myself?" And this French, interpreter from France interpreted that verbatim, and the social worker thought there's a suicidal tendency here. But all this man was saying is, what else do you want me to do? I've gone over and above. I've done whatever is humanly possible. What else do you want me to do? So that cultural intelligence and cultural humility is really important, and being bold enough to ask when you don't know without thinking you're going to offend people. So you'd rather go with what you know.
Caroline?
Thanks. I've got some question rooting back kind of to that engagement, really. So I pride myself in having been really great at working with all communities. Pre-COVID, I would just literally loiter the streets, loiter community centres, loiter places of worships, and have those conversations and drag people in off the streets if I needed to, or invite myself into spaces till I could have conversations. But obviously I've been sat at home working from my computer for a year, which is a very different way of working than I'm used to. And I have managed to create opportunities to engage with new audiences. However, this has been a very kind of white audience. And I've lost my ability to talk to all people, it seems. And I'm just wondering, in a time of COVID, when inequalities are rife, how do we build those bridges? How can I go about making sure that our resources are shared and that our understanding is shared? Have you got any tips or advice?
You want me to, I suppose, ladies first. I think what I would say, it's about building, the credibility, the credibility to be part of, speak to, engage with whoever it is or whatever community. And sometimes we may not have that credibility. I'll give you an example. One time I remember when I was working with some young people and talking in schools, high school age, talking to them about why they should not want to go to prison, and one of them turned around and he said to me, "Have you ever been to prison?" And I thought, well, actually, maybe as a visitor. I said, no, I've never stayed. No. Well, how can you talk to us about what it's not like? And I thought, actually, you know what? He's right. I don't have the credibility to do that. So next time I went with somebody that has got that credibility, somebody that had spent time, somebody that had said to me, you know what, it's not the place to be. It took a lot of convincing for this person to speak to other people. But, I had to show him that you've got that credibility, with a small C. Because it's needed. Sometimes people need to hear from somebody who has had that lived experience. If we're talking about a lived experience, it needs to be someone that's got that lived experience. You can work side by side with them, like you introduce them, bring them in. But I think it's really important that whoever has the credibility to be able to talk. And when I talk about credibility, I'm not necessarily talking, qualifications. It's not that. It's that lived experience, because if somebody was talking to me about something, I would want to know, do you have that lived experience? If you don't have it, then you can't talk to me, about that. You can't talk to me. For example, when we talk about racism, and black people are racism. You know, I would say to a white person, you can't talk to me about what it's like being a black woman and the racism I get. You just can't do it. And you may be all, you know, speaking with the best of your heart and trying, and I might listen to everything you say, and I might feel, yeah, she's right. However, in my mind, I'm going to be thinking, but you still can't tell me because you're not in my shoes. So I think, you know, when we do bridging into different communities or coming out of our comfort zone is needed, it is required. But I think we also have to make sure, I think more importantly, make sure that, you know, we've got that lived experience, because that's what gives credibility for us to be able to engage and move into or do the work that we need to do. That's what I would say.
Thanks.
Charles, did you have anything to add on that?
Well, I think Erinma said it. So, you know, you know, keep it genuine, you know, keep it real, you know. Yes, and I must say, you know, one of the models we've been using, because there are challenges within communities themselves. So, you know, back in 2014, I was working with a number of HIV organizations because the prevalence of HIV is in the gay community and the Black African, and not much inroads was being made into the African community. I knew the role of church leaders was, you know, that instrumental and influential. So I had to bring those church leaders, a number of them from the Pentecostal setting, together and asked, you know, what are some of your concerns if we have to talk about this subject, sexual health, within, you know, church? And then I asked the, you know, HIV organization, what are some of the key priorities you want to meet? And they said, okay, we could do with something around testing, treatment, stigma, discrimination, and then precautionary behavior. Our starting point with the church leaders are there any scriptures against having against treatment, against testing? You know, are there any scriptures against, you know, precautionary behavior and also the whole stigma stuff? And then, you know, 20 of them were able to agree, clearly not. You know, Bible is not against medicine and all those stuff. And then the big thing I had to use, because you know, I'm a church leader as well within the African, you know, was this around the stigma discrimination was the subject of grace and you know, being, you know, receiving something you don't merit. And on the back of preparing a guide from a biblical context, we then went on to a workshop where we had practitioners coming and delivering the talk. And then from there, they were inviting us into their churches on Sunday during the services for testing to take place in confidential spaces. So within those marginalized communities, there are issues as well. But like Erinma, it's about getting the lived experience, about that cultural intelligence, it's about, you know, being willing to take a clever approach. And then, you know, just to say, community groups will always find ways to work with the commissioners and budget holders, you know, to achieve their objective. It might not be in a linear line, but, you know, we will still eventually get there some way.
Lovely, thank you. Has anyone else got any other questions they'd like to ask who hasn't spoken already? Sarah or Julie or anyone, or any final comments?
Julie's got a hand up.
Oh, good.
Hi, I wanted to ask particularly about some of the people who are hidden maybe from services or who aren't able to access services because of immigration rules and such. I work with learning disabled people, so recently we've had an issue around being able to help someone to get mental health support because there's no access to public funds. And then, you know, is it okay for this person to get vaccinated, and all sorts of things around the fact that they're living on this, they're balancing on this sort of thing until they can get permanent right to remain, where they don't set a foot wrong and they're better keeping out of sight and not stepping forward and getting the services that everybody else would get, because if they do, they might be penalized and you know, worst case scenario, chucked out back to where they don't want to be chucked out back to. So what about things like that? You come across that?
Yeah, I mean, I've been doing some work for the Home Office actually as a Windrush ambassador. I can't remember what grand title they gave it, but basically they just stuck us in the firing line at first, you know. But they came about because, I mean, two things. I just want to say two things. Going back to the credibility thing, because I remember they asked, you know, for people to become community Windrush ambassadors, and one of the first workshops we did, you know, that you had the Home Office staff there and they were talking to people about, and they got absolutely slaughtered. They got absolutely slaughtered. But it was because of that lack of understanding of, you know, credibility, that, you know, you're reading from a script. So that had to change. And hence why they brought out, you know, community ambassadors, because we said, look, you know, in our communities, we know these people, you know, because there was an issue of people not coming forward, just as you're saying, Julie, not coming forward, they're ducking and diving, you know, they're afraid of being deported. They don't go for, you know, proper jobs or, you know, medication and that, because they're thinking, as soon as I give my name, that's it, I'll be on an aeroplane back. And I remember saying to the Home Office that, you know, I know some of those people, you know, I know them, you know, and they daren't do this, that, and the other. Some of them do get very ill. This was even before COVID, but, you know, and one of the things that we've had to do, going back to this credibility thing and integrity, because one of the things we did with central government, we actually, you know, when they asked us to be these community advisors, community reps, ambassadors, we said to them, look, and I know I can talk about me personally, I said, I'm going to be using my integrity that I have with people or in my community or in Manchester to encourage people to come forward to get their papers. I don't want to hear that someone I've asked to come forward because they've only come forward because of the integrity they have in me or my name, and then you've stuck them on an aeroplane. You know, I said, I don't want that. So what we've had to do is actually get central government to put in writing that when we're talking about the Windrush thing, it's not about collecting data to put people on aeroplanes. And if that was to happen, they are solely wrong, because we already know the whole Windrush thing is a big old scandal and messed everything up anyway. And that people, you know, because what we were trying to do is encourage people to come forward to try and sort out their paperwork, see if they can, you know, be here or not. And then if it is a yes, but you've got to wait for your paperwork, then they can go for things like benefits or healthcare, you know, housing, whilst everything else is being worked out. Also, if it worked out that they were not entitled to their stay here, you know, unfortunately, they'd have to go back and crawl under that stone, only because the Windrush help team that we're part of is not about, oh, right, they're not entitled, so now we're going to pass all their details on to immigration, you know, because they were not about that. They would give them advice as to what to do. And hence, that's why there's another department now that are actually offering people voluntary return, you know, even if they've, you know, as overstayers, voluntary return rather than hiding back under that stone. So in answer to your question, what to do, it's again, going to what's the root cause. Have they gone down, have they researched or gone down all possible avenues to actually get their stay? And I even thought, as you mentioned that question, I thought it's a very good question that people who don't have their stay or are waiting or whatever, what do they do with regards to the vaccine? I mean, it's an excellent question, and which I think I will take back, because I think that is an excellent question. We want to encourage people to come for the vaccine. We want to encourage Black people to come for the vaccine, and a lot of them are probably, you know, some who are not coming forward, maybe those who are afraid to come forward because they don't have their stay. And if I go and register, you know, they might not even be registered with GPs, you know. So go on, Julie. You're on mute.
In terms of the GP question, some of this is new to me, so I'm learning as I go along with particular situations. But what I've heard from one place is that you can register with a GP if you don't have permanent right to remain and you have no access to public funds. You can register with a GP and the GP has to provide emergency treatment.
Yeah.
But anything other than that is discretionary. So if the GP doesn't want to refer somebody for mental health care that they need, they don't have to. But also I've heard that a lot of GPs do provide more than the basic emergency stuff. So it's just finding information on that is very difficult. And it's probably one of the things where if you're in a community where that happens, you know, and people have that information. But I don't. I'm scrabbling around trying to find what can we offer this person. We don't want to be putting them forward for things that are going to land them in trouble. On the other hand, we do want them to be able to get help that they're entitled to get if we can only find out whether they're entitled to it or not. But
I think on the GP side, I don't know, Charles, would you know, with the GPs you've been working with, how they operate?
Yes, I think people need to be here legally before they will be entitled to register. What we've seen during the pandemic has been, you know, people can access healthcare. I mean, even initially with the vaccine, you needed to have an NHS number, and some of us lobbied, you know, at national level, and that's changed slightly. But yeah, healthcare is a big thing. I mean, when you go into A&E, I mean, I've seen that in, Manchester Royal Infirmary, for example, they would say if you don't have a GP and you're not here, you'll be treated, but then an invoice will follow that. So sometimes that, you know, puts people off as well.
Can I just interrupt at this point? I'm so sorry, everyone, but we're going to have to call this a day for now. Thank you, Charles and Erinma, for your fabulous sessions. They were really brilliant. I'm going to pass on, obviously, the slides from Erinma and Charles. If you can send them to me, so I've got your most up-to-date ones, and I'll forward them on to everybody. And I'll share, if you're okay, I'll share contact details so you can pick up these discussions after the session, because an hour clearly is not enough. But I just wanted to say thank you so much to everybody, and hope you have a lovely rest of the day. Bye.